Welcome to today's lecture on musculoskeletal infections. In this lecture, we will explore various imaging modalities and their applications in diagnosing and managing musculoskeletal infections. Musculoskeletal infections are a diverse group of disorders that involve the bone, joints, and soft tissues. These infections can be caused by bacteria, viruses, fungi, or parasites, and can result in significant morbidity if not diagnosed and treated promptly. Now, let's dive into our first topic. Musculoskeletal infections can be classified into two major categories: acute and chronic infections. Acute infections usually manifest as cellulitis, abscess formation, or septic arthritis, while chronic infections may present as osteomyelitis or infected joint prostheses. The clinical presentation can vary depending on the age and immune status of the patient, as well as the causative organism. Imaging plays a crucial role in the diagnosis and management of musculoskeletal infections. Different imaging modalities can provide valuable information regarding the extent of the infection, identify the causative organisms, and guide appropriate treatment decisions. The commonly used imaging modalities include radiography, magnetic resonance imaging, MRI, ultrasound, nuclear medicine imaging, and computed tomography, CT. Radiography is often the initial imaging modality used in suspected musculoskeletal infections. Radiographs can reveal important findings such as soft tissue swelling, osteopenia, periosteal reaction, lytic or sclerotic bone lesions, and joint space narrowing. It is important to correlate these radiographic findings with the clinical presentation to establish an accurate diagnosis. MRI is considered the imaging modality of choice for the evaluation of musculoskeletal infections. It provides excellent soft tissue contrast and multiplanar imaging capabilities, allowing for the detection and characterization of deep-seated infections. MRI can demonstrate bone marrow edema, abscess formation, sinus tracts, and soft tissue involvement. It also aids in differentiating infectious processes from other non-infectious etiologies. Ultrasound imaging is a valuable tool in the diagnosis of superficial musculoskeletal infections, especially in children. It is non-invasive, readily available, and does not involve exposure to ionizing radiation. Ultrasound can identify fluid collections, guide needle aspirations or biopsies, and assess vascularity within the infected area. It is particularly useful in detecting superficial abscesses or inflammatory changes in the soft tissues. Nuclear medicine imaging techniques, such as technetium-99m bone scintigraphy and gallium-67 citrate scanning, are helpful in diagnosing musculoskeletal infections. Bone scintigraphy can detect areas of increased bone turnover and inflammation. Gallium-67 citrate scanning is more specific for infections, as it accumulates in areas of active inflammation. These techniques can assist in identifying the extent and location of the infection. CT imaging is often employed in cases where there is a need for detailed evaluation of bony structures or in cases where MRI is contraindicated due to metallic implants. CT can provide detailed information about cortical bone destruction, periosteal reaction, and abscess formation. It aids in surgical planning and assists in image-guided interventions. Tuberculosis, TB, can affect the musculoskeletal system and pose diagnostic challenges. Imaging plays a vital role in the evaluation of musculoskeletal TB. Radiography may reveal bone destruction, joint involvement, and soft tissue masses. MRI helps in early detection of TB involvement, demonstrating marrow edema and enhancing any abscess formation. CT and nuclear medicine imaging techniques also contribute to the diagnosis of musculoskeletal TB. Postoperative musculoskeletal infections can have significant morbidity and may require surgical intervention. Imaging modalities such as MRI, CT, or ultrasound aid in the identification and characterization of postoperative infections. These imaging techniques help determine the presence of abscesses, sinus tracts, or prosthesis complications, which play a crucial role in management decisions. Prosthetic joint infections are a challenging complication after joint replacement surgeries. Imaging, including MRI, CT, and nuclear medicine scans, aids in diagnosing and characterizing prosthetic joint infections. These modalities help assess the extent of infection around the prosthesis, detect paraprosthetic fluid collections or sinus tracts, and evaluate for loosening or mechanical complications. Immunocompromised patients are at increased risk of developing severe musculoskeletal infections. Imaging, in conjunction with clinical findings, plays a crucial role in assessing and guiding the management of these infections. Techniques such as MRI, CT, and nuclear medicine imaging help evaluate the extent of infection and aid in prompt initiation of appropriate treatment. Interventional radiology techniques, including image-guided needle aspirations, biopsies, and drainage procedures, have revolutionized the management of musculoskeletal infections. These minimally invasive procedures provide accurate diagnostic information and allow targeted antibiotic therapy or drainage of abscesses. Interventional radiology has significantly improved patient outcomes and reduced the need for open surgical interventions. In conclusion, imaging modalities play a critical role in the diagnosis, management, and follow-up of musculoskeletal infections. Radiography, MRI, ultrasound, nuclear medicine imaging, and CT each offer unique advantages in specific clinical scenarios. Understanding and appropriately utilizing these imaging techniques are essential for accurate diagnosis, treatment planning, and monitoring the response to therapy. The comprehensive evaluation of musculoskeletal infections requires a multidisciplinary approach involving radiologists, infectious disease specialists, orthopedic surgeons, and other healthcare providers.